Hello everyone, this is Karthik Yadagiri, your physical therapy doctor from the American Institute of Physical Therapy, an affiliate of IPTA. The reason why I'm here today making this video is because of the increased demand and a lot of you who have asked me to make a video on IASTM. Here it is, guys. So before I get started, I want you to tell that you could use tools of different kinds. You could use your hands all day to do the mobilization of the soft tissue, the fascia, which is your connective tissue. But I'll tell you why it's better to use the IASTM. The reason why IASTM is useful is because these tools are designed in such a way that they have different contours. So all these contours are for a purpose. All these edges have a purpose. So you cannot use your fingers and dig into the patient. This gives you a lot of chances to use it in a better way. And also, it has some weight to it, specifically designed so it can penetrate the superficial fascia and the deep fascia based on the direction of pressure and the speed. It alters different areas and receptors of your nervous system, causing different impact based on what you want. For any typical patient, I'll tell you what it's going to be for. The indications are to mobilize any soft tissue structures, including fascia, tendon, ligaments, of course not the blood vessels. You can also mobilize the bone, but it can have a stimulating effect. But definitely on the nervous system and all the superficial and deep fascia, it's a great tool to use. But at the same time, you have to know having different shapes and different sizes is basically for the body types and the area you want to cover quickly. So I'm going to use this as an example for one of the patients who's coming to me for neck pain. For neck pain, I would have completed the assessment. I would have done the functional movement assessment, which you'd also see in one of our videos. But I would use this as different pressure based on the contour. First, I would use concavities, very light pressure for pain. As you can see, the flatter and parallel I am, I can use this for pain. The intensity is very low and the pressure is less than about 5 grams of pressure. So what I'm demonstrating are the different strokes you could use. So I could go a little bit at 20 to 30 degree angle and go in different directions because the goal is to cover the fascia in different directions. So I would typically do this on patients with neck pain. If the pain is on the right, I would stay away from it first and do it on the left to correct mobility restrictions, all based on the assessment. I just want you to get an idea. But if I want to use larger areas to cover for mobility, I would use my long bar, the mobility bar, on the area so I can really dig into the tissues and go in different directions. Well, guys, I could use my hand to do this, but I wouldn't have a good support, nor I would be able to pull like this. I can't catch. That could cause pain to the patient. So this is a very good tool to use. You just have to know how to use it, which we will be doing in our subsequent videos. But I want you to know, but I could use different strokes. The goal is to use different directional pressure, not one direction, to cause the effect of mobility. So I could go both directions of the area of mobility restrictions. If it's a mobility restriction, that's what I would focus on, small holes. And there's a progression to do this, in which you'll also learn in subsequent courses you take or more videos if you want to see. I'll tell you why, what direction, what pressure. But for now, I want you to see it's a lot easier for me to move with my tool and it's comfortable to the patient for mobility. But if I want motor control, I want to increase the sensitivity or pain, there's a different pressure and direction. Now if I want things to fire better, if they're not working well, I could go at quick pace. As you can see, my speed is a lot faster. It's almost about 150 to 220 beats per minute, very fast, so I can excite the areas that are not working. So if I feel if this area is not active very much, hypotonic, then I could use it for speed. But if I feel like it's hypertonic and it's stiff and doesn't move, then the pressure is different, as you can see. But remember, all the motions for the fascia are in very different directions because the fascia is a matrix. It's blended like many layers between layers. So that's what you're trying to do. All this does is gives the nervous system a different input so it can make a change. I hope this gives you an idea what these tools are for, how they are to be used. And if you want to know specifically for any clinical conditions, I would like to next time start with a series of problems. So like a neck pain patient, what would you do? For a knee pain patient, what would you do with the tool? If a shoulder pain patient, what would you do with the tool? If that's what you want, let me know in your comments and subscribe to my channel and I'll make more videos for you. Hope this helps. Have a great day.